Welcome to our show Health and Wellness, Myths and Facts. I'm Ambika Singh Kama. As of now, we know that Omicron is a less severe variant of the COVID-19 virus. In spite of that, people are getting hospitalized, though their numbers are less compared to the second wave of COVID-19. It is visible that vulnerable people, like those with comorbidities like diabetes and heart disease, elderly people, people who have not taken both their vaccine doses, can have a severe form of COVID-19 following infection from Omicron. People with diabetes should take extra care as they suffer from various other comorbid conditions too. The rate of diabetes diagnosis is increasing around the world, including in India. India has the second highest total population in the world at more than 1.3 billion people. Like many cultures across the world, daily life in India is changing. As the urbanization of cities continues, more people are leading less active and sedentary lives. Not just type 2 diabetes, even type 1 diabetes prevalence is also increasing. By country, India now has the highest estimated number of prevalent type 1 diabetes cases in people under the age of 20 years. The increased use of social media has led to a flood of misleading information. Expert advice from our expert panel will help our viewers get the medically correct information and act accordingly. So if you have any questions you would like to ask our experts, please send them to us via WhatsApp to the following number. The number is +91 91 67 666 941. That is the number to send us your questions for our experts. Do also send us your name and your location. Today we have with us Dr. Anurag Seth, MBBS, PGDCC, PGDCE, PGDRM, Consultant Physician, Diabetes and Heart Center, Prayagraj, and Dr. Mayank Somani, MD, MRCP, FCCP, Chief Consultant, Endocrinology, Internal Medicine, Critical Care and Emergency Medicine, Apollo Medics, Super Speciality Hospitals, Lucknow. Thank you all so much, doctors, for joining us today. Starting with you first, Dr. Seth, the Omicron coronavirus variant seems to produce milder symptoms and fewer hospitalizations than Delta because of the vaccination. Do you think it's true that the vaccine is the reason why we see there are fewer hospitalizations and less severity?
Greetings for the day. Ma'am, would you please repeat the question?
Dr. Seth, what I wanted to actually ask you is that, the Omicron coronavirus variant seems to produce milder symptoms and fewer hospitalizations compared to Delta. Is that because of vaccination? What are your thoughts on that?
Okay, yeah. See, we cannot take this lightly. Although the new Omicron coronavirus variant produces milder symptoms as compared to the earlier Delta variant of the coronavirus, we cannot afford to take it lightly. It is seen that people who got fully vaccinated, the virus produces milder symptoms in them. People who are not vaccinated or those who have got comorbid conditions like diabetes, hypertension, COPD, asthma, and more so if the conditions are poorly controlled, the coronavirus variant produces severe symptoms in them. The poorly controlled comorbid conditions puts your immune status at a compromise, and hence the virus produces severe symptoms, and hence the rate of hospitalization and intensive care also increases. So it is highly recommendable for everyone to get fully vaccinated and follow all the COVID protocols like maintaining social distancing, wearing masks, and social hygiene. All these things and taking the simple measures will substantially reduce the risk of hospitalization, and you can pull through the illness even in domiciliary care.
Okay, absolutely what you rightly said, Dr. Seth, that one should not take it lightly and of course maintain COVID protocol, and vaccination of course is key. We have a viewer question, Dr. Somani, through WhatsApp. Our viewer wants to know, I am 68 years old with no comorbidities. I contracted COVID 7 days ago and I'm recuperating from mild symptoms I had for the first 5 days. I want to go for a booster dose of Covishield. When should I take it after the cessation of symptoms? I had taken my second dose 85 days ago.
Right. So, see, the booster dose is the recommendation currently in India is for 9 months after your previous dose, or in case if you contract COVID in between, then 3 months after you have recuperated. So let's assume that if somebody recuperates in 10 days, then that person can take it after 3 months of recuperating, even if it's beyond the 9 months of the booster dose. So suppose if somebody has taken it, next month is 9 months completing, but if he is contracted it now, then he should again take another 3 months and then take the booster.
Okay. So, I hope that answers your question. Moving on, Dr. Seth, can children develop pre-diabetes if they are underweight but are leading a sedentary lifestyle during the pandemic? This is also a WhatsApp question from our viewer. Mr. S. Iyer from Bengaluru is asking this question.
Okay, so inactivity itself is an independent risk factor for developing diabetes. So sedentary lifestyle where your physical activity are quite limited, and this holds good not only for children but for adults as well. If you are leading a sedentary lifestyle, your physical activity is limited, and you are consuming a diet which is high in calorie, junk food, and so all these things leads to central obesity, and excess fat deposition around the organs leads to insulin resistance.
Okay.
So insulin resistance and all these unhealthy lifestyle, they predispose both children to pre-diabetes and adults to diabetes.
So I think Dr. Seth, what you rightly said, it's key. It's not only for children but for everybody, but it's important to stay active and of course eat
for
well.
Adults and children.
Yeah, and of course eating healthy is very important. So besides staying active. Moving on, Dr. Somani, learning that your child has type 1 diabetes causes great stress to the parents. It also means that they have to take an active role in the child's health 24/7. Obviously, they have to see what the child is eating, the insulin. So tell us, which lab tests are performed to arrive at the diagnosis of type 1 diabetes mellitus? Is this condition reversible, and what course of treatment should be followed?
See, type 1 diabetes usually afflicts somebody who has pancreas not secreting enough insulin, so that they require insulin. It's dependent on insulin. So that would be something, and usually it is bimotor, that usually either it precipitates somewhere around 4 to 6 years of age or near puberty. Now, somebody who has type 1 diabetes, how can they be diagnosed? This first thing first is either they come up with the symptoms of diabetes, which are typically like, excess urine, weight loss, or increasing want to eat more, or sometimes they land in the hospital with infections or some acidotic problem like a ketoacidosis. Ketones are increased, especially in type 1, and that's how they present. And once they present, then we do their fasting blood glucose, glycosylated hemoglobin, and the fasting and the PP, the postprandial sugar, that will tell us whether the person has a certain amount of high sugars. But there are certain tests which are very specific for type 1 as well.
Okay.
And that differentiates from type 2 in certain cases, like a GAD antibody, which are antibodies against the pancreas cells which secrete insulin. So once you are diagnosed with type 1, then you are dependent on insulin, and one should take the insulin properly as prescribed, as required, and as prescribed by the doctor.
Okay. Okay, rightly explained. And type 1 diabetes is not reversible, right?
No, it's not reversible. You are dependent on insulin throughout your life.
So that's why extra care needs to be taken. Dr. Seth, we've understood that it's not reversible, but tell us, type 1 diabetes and type 2 diabetes are two different types with different mechanisms. Even the age of onset is different. Are there symptoms similar in type 1 and type 2 diabetes?
The symptomatology is almost similar in type 1 and type 2.
Okay.
But type 1 patients have, as doctor rightly said, the onset of the disease is much earlier in type 1 diabetes as compared to type 2. Okay. We see type 1 developing mostly before 30 years of age. And the type 1 diabetic patients, they are mostly lean, and they are more prone to diabetic emergencies like diabetic ketoacidosis, and there's an entity called HHS. So yes, on a broader perspective, the symptomatology and complaints are similar in both the disease entities, be it type 1 or type 2. But type 1, yes, shares a bit more of the complications as compared to type 2.
Okay, so more complications. Dr. Somani, if I can just ask you, what are your thoughts on this? Since you've explained, we've understood the symptoms, we've understood the difference. What are your thoughts between type 1 and type 2, and how does one manage them better?
See, once you have an understanding of type 1 and type 2, you're very clear that type 1 is dependent on insulin requirement, and even sometimes type 2 as well requires insulin. However, once you've diagnosed, then you can actually control it throughout life. Diabetes is one disease if you have good understanding of it and discipline, then you can control it forever. So it's good to be in knowing about it, and yes, complications in type 1 are diabetic ketoacidosis, as the doctor mentioned.
Yes.
And in type 2, we have complications which are related to more like cardiovascular, like stroke or heart attack, and then eventually eye complications or nerve complications and stuff. So one should be careful with enough knowledge and take proper treatment.
I think that's important, careful enough knowledge, being aware that one has, whether it's type 1 or type 2, I think knowing that and proper treatment and managing it well, I think that's what diabetes is about. So on this note, we're going to be taking a very short break. We'll be right back. Welcome back. You're watching Health and Wellness, Myths versus Facts. Dr. Somani, we're talking about diabetes, type 1 diabetes. But the question what I want to ask you here is, all people who have type 1 diabetes and some people who have type 2 diabetes need to take insulin to help control their blood sugar levels. What are the right and wrong ways of using insulin?
See, that's a whole big topic, but let's start. It depends on the type of insulin which you're taking, number one. Then, the number of times you're taking. And, there are various ways by which you can take. There are pens available. You can use your own syringe. So you will have to be very careful as to how you do it. The first thing first is, what are the sites? The sites are the arm, the leg, or the abdomen. Usually we advise abdomen because it's easier for self-administration as well. Now, you have to make sure that the insulin is delivered just beneath the skin in the subcutaneous fat plane. It should not go into the muscle, and it should not stay in the skin as well. So there is a method to do that. You pinch your skin and you make sure that the skin is clean. And after 10 seconds of applying the alcohol rub, then you pinch the skin, deliver it just below into the subcutaneous fat, and then leave it there and make sure that as per the insulin, you take the food depend on the type of insulin. Suppose if it is ultra short acting, you can take the food then and there. Or if it is a regular insulin, then you have to take food after half an hour. So you'll have to maintain that. And also you have to recycle the site. You can't keep using the same site for the insulin administration. So in the abdomen at the various places, or you can you can use the arm and the leg as well. So it depends on how the doctor has structured it.
Yeah. Okay,
also, there are long-acting insulins which have to be used at a certain time, and they are also advised as to how they are to be inoculated in the same areas. Plus, how you have to eat after that. That's also very important. You can't go without food after putting in insulin, and you have to reduce the dose and increase the dose if you're increasing or decreasing your carbohydrate intake.
Okay. So in fact, Dr. Seth, like Dr. Somani has told us where to take it and how to take it, could you tell us when should a person take insulin, and does it depend on the type of insulin injection that he or she is taking, and what types of insulin are really available in the market?
Okay, so as far as insulin therapy is concerned, it is always to be taken on the advice, on the prescription of a doctor.
Okay.
And the variety of insulins which are available for administration, now we have really a large variety of insulins, right from the short-acting, fast-acting, ultra-fast-acting, intermediate-acting, and long-acting insulins. Depending upon the patient profile and the status of the hypoglycemia, the poor glycemic control, we advise the patients to take insulin.
Okay.
The regular insulin you have to take 3 times a day just before meals. It allows you 15 minutes to 30 minutes before meals you can take it, and then you can have your meals. There are intermittent-acting insulins and there are long-acting insulins. Long-acting insulins you have got to take once a day. So they give you a coverage of 24 hours for your glycemic control, for your sugar control.
Okay.
But then again, regarding insulin therapy, we can take insulin in pregnancy, diabetes. We recommend taking only insulin, not oral medications,
Okay.
because diabetes in pregnancy puts the mother and child both at risk of certain complications.
Okay.
Especially the child is prone to development disorders if the mother is diabetic. So we recommend only insulin and not oral medications to protect the child from any developmental disorders. Similarly, patients who have got comorbid conditions like chronic kidney disease, those who have got kidney compromise, in those also we recommend taking insulin because oral drugs are not that safe.
So I think you all have explained us that really well, Dr. Somani and Dr. Seth, about insulin therapy and how crucial it is. Dr. Somani, blood sugar testing is an important part of diabetes care. Do people who take insulin injections need to monitor their blood sugar levels daily?
Yes, see, blood sugar testing is an integral part of the diabetes management. Without that, one cannot know as to how the insulin requirement is and how it is faring. So what should be done is that, and this depends, the blood sugar monitoring is completely dependent on person to person, individual to individual, and depends on how intensive his insulin regime or drug regime is. So sometimes you have to test maybe 6 to 8 times in a day, and sometimes you can do it by just twice in a week just to see monitoring. But blood sugar testing is a very integral part of your diabetes management, like your meal program, your exercise program, your insulin therapy, your oral therapy. Similarly, the blood sugar monitoring, home blood sugar monitoring is very, very integral part and important part of your diabetes management.
Okay, so I think that's an important point taken, that blood sugar monitoring is key to manage diabetes well. Dr. Seth, tight glycemic control is considered an essential strategy to prevent chronic complications in people with diabetes mellitus. What are blood sugar goals for people with type 1 and type 2 diabetes? Dr. Seth, can you hear me? Dr. Somani, okay, I think we are having a little technical issue. Dr. Somani, tell us that tight glycemic control is considered an essential strategy to prevent chronic complications in people with diabetes mellitus. What are blood sugar goals for people with type 1 and type 2 diabetes?
See, the blood sugar goals which have been documented at various levels, there are different people will have different requirements. For example, a young person who has to live through a very longer period and does not have any complications, a 6.5 of HbA1c or below is considered to be good until unless he's having recurrent hypoglycemia, like low sugar events, then we'll have to re-strategize it and make it maybe 7. So there is no hard and fast, clear cutoff that below this and above this. So from between 6.5 and 8, different people will require different goals, and similarly for fasting blood sugar as well as PP blood sugar. In general, a fasting blood sugar less than 126 and a PP blood sugar less than 180 is generally considered good, and a HbA1c less than 6.5 is generally considered to be an overall marker. But sometimes you have to take 7 as HbA1c, sometimes 7.5 and sometimes 8. So it also has to be individualistic, but just on broader terms, these are the values which we have to consider.
Okay, so in fact, thank you so much, Dr. Seth and Dr. Somani, for explaining us everything about diabetes, whether it's the symptoms, how do you differentiate between type 1, type 2 diabetes, insulin therapy, and a lot more. So thank you so much for that, and thank you all so much for watching. A lot more news on the other side.